So, how can regular health checkups help prevent chronic diseases like diabetes, hypertension, and heart disease? And you?
I see my patients about every 4 to 6 months, depending on their disease state. Sometimes more frequently. I got some patients that want to see me every month. But so, say for example, you have a patient with diabetes. We try to check their blood work, including something called the A1C, about every 4 to 6 months to make sure that their sugars are being maintained. And you know, it's important, even if patients feel fine, that they come in for their checkups, because there's nothing like having a sit down with the patient, because you start to ask the questions that you may not ask just if a whole year or so goes by. A lot of things can build up. And so anyway, you know, it's important to have that regular visit with the patient. Sometimes they see it as a bit of a waste of time, like, well, we didn't really do anything here, you know, you're not really doing anything. Well, it's not about that. It's about, as an internal medicine doctor, it's really about getting to know the patient, knowing what their needs are, checking the labs for you know, changes, anything that might have changed. I got some patients that their A1C jumps way up and way down from, you know, visit to visit, and so I want to find out, well, what caused that. You've been eating too much king cake, eating too much, you know, that kind of thing, or you know, or are you doing better? Are you in a new exercise program, that kind of thing. So yeah, I mean, it's all about regularity. And on the flip side of that, when I have patients who are pretty non-compliant with their visits, and I do, this is about the time of year where I start to kind of have the front desk call around and get them in before the end of the year, to make sure that, you know, we haven't seen. I had a lot of patients in the last month or so that I hadn't seen in about 2-3 years. Well, sure enough, we go to do their blood work, and their A1C is way off the charts, you know. So it's and then sometimes, I don't want to say it's too late, but you got to do a lot more aggressive action, different treatments, more expensive medicine. So it's best to just keep up with everything. It's kind of like getting your oil changed, you know. You don't wait till your car is stalled